Hello viewers, today is Coffee Talk number 4, and our conversation today will be about some of the other challenges on the business side of collaborative dental hygiene practice.
And it's good to be back to talk about collaborative practice again, but as we're realizing as we're going through the ins and outs of this delivery model that a lot of questions continue to arise. In a previous segment, we discussed the need to increase the number of dental hygienists who are involved with collaborative dental hygiene practice. And even with the excellent statutory changes that came about in the introduction of collaborative practice in 2001, the numbers of dental hygienists currently involved in this practice model has remained relatively low. So as we move forward in our discussion with these coffee talks, and as we move to the future, we need to talk about some other strategies that are going to help encourage our colleagues to consider an opportunity in collaborative dental hygiene practice. And we need to think about strategies that increase the number of not only collaborative practice agreements that are written, but more importantly, the number of people who are actually engaged in the practice in the community. And I know that one aspect that we haven't talked about yet, but is definitely on the minds of our colleagues who are exploring the option, is how to make collaborative dental hygiene practice financially viable.
Yeah, I think this is probably the most complex area that we can talk about today, and where we get a lot of questions from dental hygienists. We realize that the majority of dental hygienists are currently in private practice or in group practices. And so we really don't know how prepared they are to tackle the issues, especially the financial issues surrounding this model. There's a lot to learn. And many of the questions we get are about financial issues. One of them is, how do we finance a practice like this? And we know billing can be done for services rendered. But certainly, Claire, there are grant monies that should be available for the development and also the sustainability of a collaborative practice.
And that's a really important subject to talk about, because keeping a collaborative dental hygiene practice sustainable is really reliant on consistent funding. And billing for services is first and foremost the way that the majority of the income would be generated for that program. But collaborative practice hygienists typically have to fundraise, and they also need to become quite savvy about grant writing. And in particular, they need to do this continual sustainability to subsidize the care to provide, at least for the persons who are uninsured, who might be seen in these collaborative practice settings. So you'll find an excellent tutorial called Grant Writing Basics on the Normandale Community College Minnesota 21st Century Dental team. The overarching message of that tutorial is to think outside the oral health box when you're seeking grant funding, because we always tend to just think of our own profession. But we want to also search the internet for foundations that might be located in the target area of the population that you want to serve. Those nonprofits often will be funding programs that have the same sort of mission about community service, and that's what collaborative practice is all about. And also, as oral health continues to become more integrated with medical health, I think it's really important for us to think outside the box there as well. And there could very well be some very untapped opportunities for financing that would fit very well with collaborative dental hygiene practice.
Yeah, and we'll talk a little bit more about that, I think, in Coffee Talk 5. But we should delve into the billing and reimbursement a little bit more heavily today, I think, and other financial aspects. And because collaborative dental hygiene practice is usually involved with treating people who have fewer resources, most of these people are on public programs or state-sponsored insurance programs. The Minnesota Department of Human Services, I should say, is very helpful in billing and requirements surrounding Medicaid to public program recipients. Also, we should know that most of the time the billing is done through the dentist who collaborates with the dental hygienist, or the nonprofit's provider number. And these are national provider identifier numbers we're talking about. But we firmly believe that dental hygienists still need to acquire their own national provider identifier number, where they become the rendering provider who is doing the services. And we know the billing or the reimbursement can't come directly to them, but we know that it's important for us to track those services that the dental hygienists are actually doing, so that we understand what an impact collaborative practice is making. So it's very important that we encourage dental hygienists to do that, to find out if they're making a difference.
I agree, and it takes time to do that, but it's so important. And reimbursement from Medicaid and other payers can be that crucial funding stream for collaborative practice. One thing that is talked about a lot is that the importance for extraoral and intraoral screening and assessment as part of the dental hygiene education. When dental hygienists leave their dental hygiene educational program, they are informed about how to do screening and assessments. Screening and assessments are critical to the triage of the dental needs, and they're also critical to determining that patient-centered dental disease prevention and what sort of education that person might need as well. There are dental codes. There are codes for screening and assessment that could be entered into a dental claim form. However, currently the Minnesota Healthcare Programs does not reimburse dental hygienists for both of those procedures. One reason for that is that screening and assessment does not produce a tangible procedure. And in dentistry, typically oral health professionals are not compensated for the time that we take in the provision of our care.
That's right, and because of that gap, we really need to have some intentional conversations with policymakers and with payers to get them all on board as to the importance of reimbursing for these important services, especially the screening and assessment, which could really make or break the viability of a collaborative dental hygiene practice. Policy changes for reimbursement at the state and payer level definitely would increase the sustainability of these practices. But without claims data, it's really hard to validate the success of this workforce opportunity. So we have some work to do in that area.
And another thing that needs to be delved into when considering collaborative dental hygiene practice is that dental hygienists serving public program recipients also need to be familiar with the Minnesota Healthcare Programs Provider Manual. It is all online now, but it outlines the coverage and the frequency of services that can be provided to Minnesota Healthcare Program enrollees. For example, dental hygienists are well positioned to serve patients with special healthcare needs where they live in their own environment, such as group homes and day programs. It's extremely important to ensure that that care provided in those settings and to that population is equivalent to the care that is provided to other patients, whether it's provided in a community setting or a traditional dental practice. We're fortunate in Minnesota that a limited number of dental hygienists, of dental services, I should say, are covered for non-pregnant adults. That isn't the same throughout the country. And with or without disabilities, the coverage needs to be equivalent and the reimbursement needs to be the same, no matter what characteristics and needs that patient might have.
So as you can see, we have some work to do to make this model more financially viable. So we're going to keep the lines of communication open, and we know collaboration with stakeholders is very key to the success of these programs. So we look forward to when collaborative practice is fully integrated into the healthcare delivery system and healthcare access.
Right.
So next time, we're going to look into the future and look at some healthcare trends to see how collaborative practice fits in. So until then,